Psychosocial Case Study, Miguel. Good afternoon, my name is Britney Uzcategui, and I am the occupational therapist that's going to be assessing Miguel today. Miguel is an 82-year-old Hispanic male that is seeking occupational therapy services to address several challenges impacting his ADLs, IADLs, leisure activities, and social participation. Following the loss of his wife 2 years ago, he has expressed feelings of depression, and feelings of anxiety that have also decreased to his social participation as he primarily relies on family for interaction. Additionally, Miguel has age-related issues such as arthritis that is impacting his ADLs and IADLs. Furthermore, Miguel feels unmotivated to engage in leisure activities such as gardening and walking, which both promote physical health and emotional fulfillment. Miguel aims to enhance his independence, find meaningful ways to cope with his past, and improve his emotional and social well-being. And assessment tools that I used for my interview included the modified Barthel. I administered this on Miguel and he scored a total of 18, would suggest severe dependence, indicating Miguel needs significant assistance with his daily activities. This information is vital to occupational therapists for planning his interventions and enhancing his overall independence. An additional assessment that I administered on Miguel was the Beck Depression Checklist. It was given to Miguel in which he scored a 26, which indicates moderate to severe depression, suggesting that Miguel would benefit from targeted interventions to address his emotional well-being. A formal assessment that I might use if I had this individual as a patient would be the COPM, the Canadian Occupational Performance Measure. It would be an excellent tool for Miguel for different reasons. First, it emphasizes a client-centered approach by allowing him to identify specific activities that are meaningful to him and the challenges that he faces when performing them. This approach can ensure that occupational therapy interventions are tailored to his needs and preferences. Additionally, the COPM facilitates the identification of priorities, enabling Miguel to articulate which areas of his life he wants to focus on, such as specific ADLs or IADLs. The COPM provides a reliable baseline measurement for Miguel's perceived performance and satisfaction in various activities, which can be very beneficial for tracking changes over time and demonstrating progress. It offers a holistic view of occupational performance by considering not just the execution of the activity, but also the emotional aspect of it, which is particularly important for Miguel as he's coping with grief while experiencing decreased social participation. Additionally, completing the COPM can empower Miguel by actively involving him in his own journey, fostering a sense of ownership that is crucial for adherence to therapeutic interventions. Over the years, Miguel has experienced significant changes in his daily routines and occupational performance following the loss of his spouse. Prior to the loss, he engaged in structured daily routines enriched by meaningful occupations such as gardening, socializing with his family and friends, participating in community activities that fostered a sense of belonging. However, after the death of his wife, he found a profound disruption in his routines, leading to diminished engagement in activities that he previously enjoyed, and also a decline in his physical activity levels and social participation. Miguel has experienced some acute grief characterized by intense emotional distress, anxiety, and withdrawal from social interactions, thereby negatively impacting his occupational engagement. Over time, he likely experienced fluctuations in mental health between periods of stability and episodes of depression and anxiety, particularly when confronted with reminders of his wife. These mood fluctuations resulted in increased reliance on family support for emotional regulation and social interaction. Despite these challenges, Miguel began to identify some strategies that he's tried to help him out with his stability, but he continues to have lack of motivation. Miguel also recognizes the benefits of physical activity through gardening and walking, which he used to do previously, and he is aware that these adaptive strategies, including mindfulness and meditation, can also help with emotional processing and help with anxiety. By seeking out and engaging in these meaningful activities, he can begin to reestablish a sense of self. If he begins occupational therapy and engages in therapeutic interventions, these experiences may further equip him with the necessary skills to manage his emotional health effectively. Miguel's journey is marked by profound loss and fluctuations in mental health, and his identification of strategies empowers him to enhance his independence, his emotional well-being, and engagement in meaningful occupations. Miguel is increasingly able to identify effective strategies that can help him maintain his stability. Through his experience, he's learned the importance of social support, specifically with his family. By engaging with his loved ones, he does find that helps his emotional support. Additionally, having a structured routine has been proven to be beneficial for Miguel, and he has come to understand that engaging in these meaningful occupations can foster a sense of accomplishment and joy, which is vital for his mental health. Social and environmental factors that have contributed to well-being include family support, which is one of the most important factors contributing to Miguel's well-being is the support from his daughter and his grandchildren. Their presence provides emotional reassurance and companionship, helping him to fight any feelings of loneliness or isolation. Regular family interactions foster a sense of belonging and connection, which are essential for emotional health. Challenges and goals were discussed with Miguel, including difficulties with his ADLs. He reports challenges with specifically dressing, bathing, and sometimes toileting due to the pain from his arthritis, and also sometimes just not wanting to engage in some of these ADLs due to not being motivated, which can lead to frustration and decreased independence. He has limited social participation following the loss of his wife, so he has become increasingly isolated, which has affected his mental health and emotional well-being. He's reluctant to engage in any community activities that further compounds this challenge. Miguel aims to regain his independence in his ADLs, engaging in his IADLs, and also leisure activities and social participation. He wishes to participate more actively, both with his family and within the community, to combat any feelings of isolation. In order to work towards achieving these goals with Miguel, we can work on customized ADL training. I would assess Miguel's specific challenges with dressing, bathing, and toileting, and if he's having issues with the arthritis due to gripping and fine motor and dexterity, I would help him with adaptive tools such as maybe a dressing aid, and in the shower, a long-handled sponge. Also making sure that there's proper lighting. I can help him regain his independence in these tasks with practicing sessions focused on these activities to reinforce the skills and build confidence. For social participation, I would address this by encouraging Miguel to explore community resources and programs designed for seniors. Facilitating introductions to local clubs can help him build new social connections. I would also work with his family to plan regular activities that foster interactions, such as family outings or shared hobbies. Incorporating mindfulness and relaxation techniques into our sessions can also be beneficial for Miguel to manage his stress and coping with emotional fluctuations stemming from his grief. This could involve teaching him breathing exercises or encouraging participation in enjoyable low-stress activities. Evidence-based interventions tailored to Miguel's improvement for his quality of life and occupational performance would be the effectiveness of assistive technology for older adults and the influence of frailty. This is a systematic literature review of randomized control trials, and this would pretty much work on different assistive technologies to help with Miguel, such as built up handles and utensils for dressing purposes when he's bathing, long handled sponge, and also um, different home environmental interventions to enhance the safety and independence of Miguel. Another evidence based article is Social Engagement and Well-Being in Late Life, a systematic review. This talks about aging in society and how important it is to incorporate social engagement in late life to promote overall health and well-being. So this is particularly important for Miguel, working on different ways that we can get him back into engaging in social participation, looking at different community resources and programs designed for seniors in his area can help him build new social connections and get him back to engaging in social activities. And cultural competence principles that I should keep in mind when I'm planning and implementing interventions to support well being is Miguel's right to make informed decisions about his care and interventions. I think that is so important. Engaging him in discussions about his goals and his preferences, ensuring that he feels empowered and that he feels involved in the therapeutic process. This principle also involves acknowledging his past experiences, his values, and his relation to his grief. Cultural sensitivity is also very important. Understanding that Miguel has a strong sense of his Cuban heritage and the cultural significance of family, community, and traditional practices is essential. Intervention should honor and incorporate cultural elements such as traditional cooking or family gatherings. Stakeholders that can be involved in intervention to support well-being are family members. So Miguel's daughter and grandchildren can be critical stakeholders in his care. They can participate in family-centered therapy sessions and help implement strategies at home and provide emotional support. Engaging them in activities promote social interaction and shared experience that can help enhance Miguel's motivation and adherence to intervention. Community centers, local senior centers, cultural organizations, or support groups can provide resources and opportunities for social engagement. Collaborating with these organizations can help facilitate community outings, workshops, and activities that align with Miguel's interests, maybe a cooking class or a boxing event, which can reduce any type of isolation and enhance his social participation. Including a social worker can also be helpful. They can help with any environmental factors affecting his well being. They can assist in connecting him with community resources such as transportation services or mental health support. And they can also advocate for services to help with his independence. Reflecting on my interview skills and therapeutic use of self, I recognize the importance of creating a supportive environment that encourages open communication. By building rapport and actively listening and demonstrating empathy, those are key components to the process. By being culturally sensitive and flexible, I aim to foster a trusting relationship that facilitates Miguel's engagement in therapy and ultimately supporting his journey towards health and well being. The most significant lesson that I gained from this interview with Miguel is the profound impact of empathy and actively listening and fostering a therapeutic relationship, particularly for those that are living with mental illness. In Miguel's experiences of his grief and his isolation and physical challenges, it highlighted how essential it is to approach these types of clients with compassion and understanding of their emotional context. This lesson will shape how I work in the future with individuals living with mental health illnesses by emphasizing a holistic approach, recognizing that there is an interplay connection between emotional, social, and physical factors in their lives. It can help guide my interventions. Utilizing a client-centered approach can help prioritize the individual's preferences, their values, and their lived experiences. This can empower a client and foster a sense of agency in their treatment. By focusing on building trust through empathy and active listening, I can create a safe space for my clients to express their feelings and their challenges. This is so important for those that are dealing with mental illness, where there's a lot of stigma and fear of judgment that can be barriers to seeking help. I can collaborate in the future with my clients by encouraging them to set their own goals and participate actively within their treatment plan. This collaborative spirit can enhance their motivation and commitment to the therapeutic process.